This is our deep dive video about chronic migraine. So the definition by the International Classification of Headaches is defining chronic migraine as 15 or more headache days for 3 months in a row, whereof 8 of those headache days are with migraine symptoms. 3 to 5% of the overall population are experiencing chronic migraine. This means that from the migraine population, 8% of those living with migraine are actually experiencing chronic migraine. What are the causes of chronic migraine? So for many people who are experiencing chronic migraine, these started as episodic migraine. So meaning that maybe you experienced 5 headache days per month, and in the following it was 7, and the third 10, and now you're actually experiencing 15 or more headache days with 8 days of those with migraine features in a row for 3 months. And now you're experiencing chronic migraine. And usually when you are experiencing migraine and headache days more frequently, also your medication use is increasing. For 2 out of 3 people living with chronic migraine, the overuse of medication is one of the top causes for chronic migraine. Another cause of chronic migraine and migraine in general is obesity. And while it's not 100% certain why obesity and migraine are interlinked, high blood pressure and the production of inflammatory proteins from fat cells are the main suspects of science. Intense stress or trauma can cause migraine to chronify as well. And while this is nothing new for us, chronic pain and migraine are not only physical. So there's often a comorbidity of mental disorders such as anxiety and depression that are often interlinked with chronic migraine. Also disrupted sleep, snoring, insomnia, excessive caffeine are all causes for migraine to chronify. For example, people living with chronic migraine are experiencing insomnia twice as often as people living with episodic migraine. So how is your doctor and your healthcare professional diagnosing if your migraine is chronic or not? It's usually a close look into your migraine patterns. Is there any family history associated with migraine? What type of pain are you experiencing? How often? How long does it last? And what treatments are you actually already using? What are helping? And what side effects are you experiencing? The treatment then depends very much on your diagnosis and the individual migraine pattern that your migraine is showing. I'm going to talk about 4 steps that are usually common for the treatment of chronic migraine. Step number 1 usually is more documentation to understand your individual migraine pattern. Keeping a migraine diary may be useful for this. Step number 2 is usually around managing lifestyle. So your healthcare professional may provide you with plans around exercise, diet, sleep patterns, and also exercises to manage your stress, such as yoga and meditation. And if necessary, and you're experiencing mood disorders such as anxiety and depression, your healthcare professional usually will refer you to a psychologist. Step number 3 of the treatments is usually around medication or alternative treatment methods. So your doctor or healthcare professional might give you some advice on what is the right medication if you are experiencing chronic migraine, the right dosage, the right timing to take it, and usually the first line treatment is still like over-the-counter medication, and then as a second step, special headache medications such as triptans. And if some of the symptoms such as nausea and vomiting are one of the main symptoms and disabilities of your migraine pattern, then there might be some acute medication against those provided. Many people living with chronic migraine are experiencing that the usual treatment methods that are helping the majority of the migraine population are not helping for them. So healthcare professionals might also provide alternative treatment options such as transcranial magnetic stimulation or nerve stimulation. Those 2 techniques use magnetic and electric fields to stimulate nerves or the brain. And in step 4 of the treatment pathway for chronic migraine, usually preventatives are discussed. For young adults and adults at least, many preventative medications are available. Some of those are beta blockers and antidepressants. Yet, the best way to prevent chronic migraine is to catch and recognize it early, before it really develops. So that is why it's so crucial to keep a migraine diary and to log your medication use. We also got another video about migraine diaries over here.